I'm curious, since you kind of opened the door, Sandra, for Doris, Alana, and Nenji, how has your journey with endometriosis changed or altered your relationship with your physician or healthcare systems? And then after the three of you kind of answer that, to Dr. Haben and Dr. Smitha, I want to know kind of how are you going to react to the things that they're about to say? How can we change healthcare as doctors and make it more welcoming to our patients who oftentimes don't feel heard? So I guess first, for the patients on the panel, how has having endo changed your relationship with your doctors or providers?
The Navy medical system is an addition to a different culture when it comes to medicine. With the Navy, just in general, as far as, the military, you suck it up and you continue moving on. So we already have that problem with women's health in general in society and how we approach women's periods and all of their health. And then you put the added portion of the military aspect of suck it up, continue moving, take some Motrin, you'll be all right. And I subscribed to that for way too long. Even at the beginning of my career, going through what I went through with my dermoid cyst, I sucked it up and I pressed on. I actually only got a week of convalescent leave after that surgery, and they had cut me 10 centimeters on the bikini line and kind of pushed me back. I started going to school and doing everything that I could at the Naval Academy. And I subscribed to that for that whole time, for those 14 years, I think it was, and would just trudge through everything and suck it up. And it's the diagnosis with endometriosis. And I can't even say the diagnosis, but the reoccurrence of it after my initial diagnosis, where I realized I had to make a change. This is not something you can just push through. This is not something that I can ignore to just continue along in my career. It takes over everything. As it's being invasive in your body, it's invading your life and your mental and how you feel about yourself as a woman and a professional. And I just feel, it's ravaged my identity, and I've had to rebuild that. And so I've become more vocal in the medical system. I've had to, and being in the military, I am very aggressive and militant when it comes to a lot of things. But interestingly enough, when it came to my self-care, it came to telling doctors what I need from them to be okay, it was a block. It was very hard for me to do that. I felt like I was asking for too much. I felt like I was being difficult at times when they kept on telling me, we don't recommend you for fertility treatment. Your numbers are too low. We don't recommend you. We don't recommend you. And I have one ovary. So I had my right ovary removed in that initial surgery. And so they just kept on telling me no. And I kept on saying, well, I want a second opinion. And I just kept on pushing and pushing and pushing. And it's not like I was out there like some warrior and had my shield and my sword and was just pressing through all of that and blazing a trail. It was hard. It was exhausting. There was times where I thought that was what was going to break me, is because I'm already dealing with all of this. And now I have to fight the people who are supposed to be helping me. Now I'm doing the research. I'm finding out certain treatments. I'm finding out the next step. I'm asking the questions. I'm pushing. When at that point, I really needed someone to care for me, not just treat me, but also care for me. Because I was finding it hard to care for myself and to have that energy, while, like I tell friends and family to explain it to them, like I was on essential systems only for a long time. Like I did not have the energy. I was just trying to be okay mentally, physically, get through the day. So that was my arc. That was my journey. I've had to speak up more and to bust through whatever societal norms and military norms that I've been conditioned and have put in place, thinking that there's something wrong speaking up for yourself. There's something wrong asking for what you need, that the first pushback you get, that's where you stop. because I don't do that in the way I operate in the military. If someone says no in that sense, it's like, oh, okay, well, let's get creative and figure this out. So that's what I've had to apply to my health. Let's get creative and figure this out, because I'm not okay, and I'm not okay not being okay right now.
I think for me, on a very practical level, even though it's actually 6 years this May since the diagnosis, but having had symptoms for years prior to that and just not even knowing, which I really appreciated when Sandra was going through the symptoms she had, and just to tag on that, the awareness of which I wish I had had earlier, right, of those symptoms, because I would have communicated those so much sooner to doctors. And so I think in a couple ways I'll answer this question. I think one would be on a very practical level, documentation. Like even to this day, when I've changed jobs and I have new providers, I still literally take the printout from Kaiser in Southern California that showed my diagnosis to any doctor I go to. I also have been documenting everything, right? As someone who's still trying to find ways to manage her treatment. I document my cycles. I document how, I take continuous birth control to try to eliminate cycles at times, because if I do have a cycle, even now it's completely debilitating. Like I will have at least 2 or 3 days where my legs are just, inflamed, and I'm on hot heating pads for the whole weekend and I can't really move around. But I'll talk about what my breakthrough bleeding, like everything I just document, right? And that's one of the biggest things in my personal and professional life with people I advocate for. I'm like, document everything, because 26-year-old Nenji was in those 10 months of seeing so many doctors, would walk in spaces and I'd be like, hey, I'm still not feeling well, or hey, I've been on this for 3 months, it's not changing anything. And like, oh, okay, we'll just update it. Again, there was a lot of minimizing of the pain. And I'd go back in my car, and not even as a crier, I've said this before, but I would be like, I feel so alone. I don't get it. Like this isn't fixing the pain. And so just documentation has just been huge for me as a tool to help me when I'm in front of a new doctor or a new space, to say, hey, this is what's going on. Here are my symptoms. Like my bowels have been like out of control. I've literally been 3 weeks straight this month where I just have had flare-ups. My endo belly flare-up is so like, I can't find a way to bring it back down, or whatever that is, to just be really intentional in giving dates, timelines, everything. It sounds like a lot, but it's all in my phone. So that, because that way I've found I've been able to get more of a, I've been able to push back if it's minimized, right? It's like, where's the evidence, right? And, doctors are like, oh, what's the pain scale, 1 to 10 or whatever it may be. I'm like, oh, it's 15. So like, we need to like, can we brainstorm and find some other solutions, right? And so again, on a very practical level, I tell people all the time, even friends I know right now who are going through reproductive situations, trying to either get diagnosed possibly with endo or fibroids or PCOS, I always say, go in with your list, because it can feel scary and intimidating anyway, because you don't know, right? And there's you get there and you may be nervous and you don't know how to quite not even push back, but really just name, this is what's going on with me. And I really need to walk out here with a next step, that isn't just, okay, well, it sounds like this, let's wait 2 more months. I know in some cases that may be what has to happen. But I think for me, I always feel better now, like now in my 30s, of like, I did my due diligence. I listed everything. Or once, I was having sharp pain a year ago in my left ovary, really bad. It's my only ovary that ovulates right now. And I was just like, I went in, I was like, okay, I'm going to ask this new doctor I need an ultrasound. Because there either could be a cyst, I need this. So I walked in with 3 things, and I walked out with all 3 things I wanted, right? But in my early 20s, I would have never known how to do that. I would have just said, and again, all the things the doctor agreed with. So it wasn't just me like dictating, like this doctor knew what she was doing. But again, I just think on a very practical level, that self-advocacy and being able to document and express your symptoms in a way that allows hopefully the doctor to understand the severity of it, I have found has helped at least get me towards more actionable steps than in those early years where, again, I would wait, you're anxious, you get your appointment, and then, it's 10, 15 minutes. And it's like, oh, okay, well, I guess we'll just have to, and again, which was so discouraging, especially, again, like everyone's named, for such a debilitating illness that impacts our entire lives. I think the last thing I would say too, and I don't know that this is, or I haven't seen it addressed when it comes to sort of the medical field of doctors I've connected with, but it's even just referring or helping your endo patients with their mental health, right? There's such a deep mental health toll that this takes on your mind, body, and spirit. And I've been fortunate in this last year to have an amazing therapist who I've actually been able to process some of the severity of the pain and just like the experiences that, whether it's the depression and being like, I have to deal with this for my whole life. Like, I have these plans, and then like, you know, everything just feels like it's falling apart at times. And so I think just even that piece too, and I know it's not necessarily always in the medical realm of like the doctor to be able to recommend that, but I do think there's something to be named about being transparent, like with your medical professionals on the impact on your mental health and documenting that. Because I've started doing that too. I'm like, oh, I went to a really bad depressive space during this, you know, flare up, and I know my hormones are adjusting. Like, are there things you can suggest I can do? Or are there things I could recommend to my therapist to process with? Or pelvic floor therapy is something I'm beginning to try to hopefully get to learn more about, because I've heard it can have a lot of benefits. And I think there's a lot of tension and trauma sitting in my pelvic floor as a result of this illness. And so, yeah, I would just name those two things. But I think, again, the advocacy through the documentation, and then you know, even just being honest with your doctor about the mental health toll and trying to find recommendations and referrals in that way so that you can holistically, you know, get the support you need to manage endometriosis. So, yeah.
Know your facts. You go in and know your things as well. Well, I know you mentioned it, but sometimes I say, don't tell your doctor just yet. Like, tell them your symptoms, but don't tell them what you want in a way, because you want to know if this doctor able to tell you these things that are needed for you. Because I used to do that. I used to tell them, I need this, I need that, I need that. And they'll just go with that. I'm like, but I'm not a doctor. I may have missed something. So I'm gonna give you all of my symptoms. But I know, okay, based on this pain, I need an ultrasound, but I may not mention it right away because I want to see, are you going to offer an ultrasound? Because technically this is your field, not mine. I just know my symptoms. Because you can probably like, you know what, based on this, let's go something further. And I would not have thought of that. I'm like, oh, okay, I like that idea better. So it's almost like you giving somebody paint, a paintbrush and a tile, and saying, go ahead, free draw. So I can see what you're going to come up with. So I've done that. And I realized that's like, okay, I like you as a doctor because you're giving me the tools I actually need based on what I've been searching for. And another thing I would say is like, I got into a point when I've had some amazing doctors. A doctor that helped diagnose me, I loved her. But then it got into a point that she was too busy with GYN. She couldn't no longer do the GYN, but she was doing more OB. And it got into a point, I know I have endometriosis. I need to have my doctor at some point or at any point because I don't know when it's going to happen. So from there, I found a new doctor. And like I tell my followers, I'm like, it's okay to divorce your doctor. It's okay to get a second opinion. If your doctor is not able to provide the service for you, we're not a shortage. There's no shortage of doctors. We have plenty certified people that will assist you. We just have to find them. And sometimes we have to be willing to travel sometime to find the one that's for you. And you need to find a doctor that also advocates for you. Because I found that is a very, very important piece because you may have a doctor that's, yeah, that's fine, okay. But you want one that's gonna fight for you. Like, hey, listen, this is what's coming up on your scan. I need you to come right away. I need to do further testing. Not just when it's like, oh, okay, oh, as soon as you come 6 months and like, oh, I saw this on the chart. No, I need someone that's going to advocate for me because I don't know all these medical genres. So I need you to do that. And don't be afraid to, okay, tell your doctor, I need to speak with you. So when you call their office, instead of the typical 15 minutes, could I book 20, 25 minutes? I need that extra time to speak to my doctor. They have several patients, so they may only have allotted time to speak to you. So when you book your appointment, ask for that extra time so they know, okay, this patient really needs that time. And it's okay. I haven't found like the really good ones I have teamed up with. They don't mind the advocacy. They have checked other doctors and like, I would not have given this course of treatment for this. And those are the doctors that I love because you are fighting for us that may not know the ins and outs because we didn't go to medical school. We didn't go there. We just know what's going on with our body. And we have heard it from other women that's going through the same thing. And we all are not crazy. We're not crazy. Something is off. And we need to find a doctor that's willing to listen and advocate for us. And they do exist. Sometimes you just have to search, but they do exist. I found a couple.
Yes.
Yeah, that's absolutely great. Actually, that's the same sort of thing that we do. We really focus on the support groups to kind of, because we have women who are women and girls, who are members of the support group. So we discuss, pertinent issues, things like, pointing out to the ladies that if you're taking this kind of medication, you need to be on calcium supplements, for instance. Did your doctor give you calcium supplements? Go back and get that prescription, because then you find that you're starting to have bone problems, back problems, because you didn't get the supplements. You realize that some people have been put on GnRH drugs for so long, over the 6-month period. Some are going on for 2 years, and the doctor hasn't stopped that. So those are the kind of things that we call out and advise, think of going to see another doctor. And then women who are anemic, and just getting just basic supplements and things like that. And we discuss a lot of stuff. And just like Sandra said, we also advise women to think of second opinions, third opinions, and fourth opinions. I mean, if you feel the doctor is not giving you the right treatment. We know that excision surgery is the gold standard, for endometriosis care. But we know also that in our part of the world that we do not have the specialists there. So we always try and encourage women to please, if you need excision surgery, kind of look at going out of the country to be able to get that surgery, not risking to have it in, because we have some of the ladies in our group who are, it's a hot mess. I mean, it's, you've been cut up, it's really bad. So we then kind of, encourage them to try and see if they can get the insurance companies, get some funding to be able to have the treatment in a specialized place, because excision surgery is really specialized. So yeah, because a lot of people, a lot of the surgery that occurs in our parts of the world is really ablation surgery, yeah, and which may work for when it's very minimal, but when it's not very deep, but when it's extensive, when you've had endometriosis for long, obviously that doesn't help. In fact, if anything, it will get worse. If after that surgery, the next time round, you feel even much worse than you were before. Yeah. So those are the kind of tips that we try and talk, and let the ladies know. And then in terms of advocacy as an organization, one of the things we're trying to do is ensure that through our Ministry of Health, that we have guidelines and just guidelines and standards for endometriosis and adenomyosis care, around in the country, support in terms of the diagnosis and treatment and also management of the condition. Because without that, a doctor in one part of is saying this, another one is it doesn't check to diagnose. There are no standards, and no guidelines. Yeah, so I think that would go a long way in helping to level out and in helping to support women with endometriosis. Thank you.
I think this is the probably most important topic with delivering the best care for patients with endometriosis, right? And thank you, all of you, for sharing these stories. That's incredibly candid. It's real. It's my practice every single day, what I hear. Unfortunately, I wish I could say it's the first time I've heard all of what all of you said, but it's not. I hear it every day. And we know there's a delay in diagnosis because it can be traditionally thought of as difficult to diagnose with all the different types of symptoms, right? We know that there can be a 7 to 8 year delay in diagnosis, and I'm often the 10th doctor that people are seeking out as a specialist. I think that there has to be a huge change in the medical community and in general about the open dialogue and transparency around it. So I applaud all of you for being so open and doing the phenomenal work that you're doing to pay it forward to help other people suffering with this disease and help them learn how to best seek care for it. Because unfortunately, there are disparities, tons of disparities here that we see. And the symptoms that you all mentioned are actually, are typical symptoms that we see with endometriosis. If you recognize it, you know it, you suspect it, and you go to surgery. It's not just history and the symptoms, the physical exam. If you've mentioned having advanced stage endometriosis, we're going to probably notice some of that on exam too. So, and over and over, it does get missed. I think that the conversations have to change at home. The conversations have to change with our younger people suffering with endometriosis, the education in schools. I mean, thank you to all of you. Doris, it's amazing. We have a lot to learn from you to change in this country too, and talk about menstrual cycle wellness, talk about what is, can be in the spectrum of okay, of some discomfort. And then, hey, when this starts affecting your quality of life, when you're missing school, when you're missing work, when it's altering the trajectory of your life, not okay. So you need to tell us when that's too much. And a lot of you mentioned that you kept fighting, and we know that. We know about this strong constitution and courage that keeps people suffering with endometriosis and pain and these quality of life issues to just keep looking. Oh, well, that wasn't okay. When you're talking to a provider that is hearing you, asking those right questions and understanding you. And the other thing is, it's our job to guide treatment options. I think someone's not muted, actually. If you guys wouldn't mind muting, but it's our job to guide your treatment options just based on your goals of therapy. So for a woman who's trying to preserve fertility, if you have someone offering you, removal of your uterus, well, that's not meeting my goals. So automatically, okay, that might not be the right provider for me. Excision of endometriosis is the standard. We have to excise it, and it can live anywhere. So it is complex, challenging surgery for our trainees. This is really important. And finding a physician, again, you ask those questions. Are you going to remove it from everywhere when you find it? Are you going to also remove scarring to restore anatomy? Are you going to remove all of the endometrioma? Are you, can I have pictures? I give all my patients pictures at the very beginning of the surgery and then at the very end. So they see everything. And that's like 20 pictures in total. I give them a copy of their pathology report at the end. They have their operative note. I mean, this is the time when you are totally making all the decisions in your care. And you should be able to do that very comfortably. It is, as you can imagine, difficult to hear these stories, and it's difficult to hear the dismissal of things that are very important to you in general as someone providing this care, because I feel like it's my charge in my career to change that as much as possible so that more and more women aren't suffering. In general, I think I agree with everything you said. Seek second, third opinions, find somebody, ask them the right questions that you need to know that they know before proceeding in your care with them, and doing exactly what you're doing now, which is talking very openly, doing the education, all of these opportunities to help more and more moving forward. I applaud all of you for doing this amazing work. Really, truly, thank you so much. And keep talking about this. I tell every single one of my patients, especially post-op, when they come back and see me, it's incredible outcomes after excision. I tell all of them, talk about your symptoms. Tell people, recognize this in your family members, in your loved ones, and create these open dialogues, because the longer we let this go, the much more difficult it is to manage. It's an evolution into chronic pain, and then also potentially infertility. And that has quite negative impacts on a person and changes them. I'm sure endo crosses your mind every single day, and your whole family's lives could be altered because of it. So we know that there's a lot more education. I hope we all continue to do this together. But yeah, I think from my perspective, all I can do is keep doing as much education as possible too.
That was great. I just want to add that speaking from kind of a more generalist perspective, especially as a trainee in this career still, I think we see a lot of patients that are kind of the undifferentiated patient. They come in with a complaint of pelvic pain, and they don't know about endometriosis or fibroids or any of it. And I think Nenji, when you described being first diagnosed with, I think you had described being diagnosed first with fibroids, and being in the fibroid belt, kind of in the South, and especially majority Black women, I think endometriosis is far from our minds when we think about pelvic pain, and it really shouldn't be. I think it's something that is so underdiagnosed in women of color specifically. And being a woman of color myself, I want to be an advocate and make sure it's something that's at the forefront of our minds. So it doesn't take 7 to 30 years to diagnose this in a patient. And I think the education piece is key. I think kind of advocating and encouraging patients to keep symptom diaries and to keep track of what's going on and when, I think is super important, because it not only helps us understand that, hey, this doesn't make sense with our other, thoughts or other differential diagnoses. This is pointing towards something else. And I think when we're able to have our patients teach us something, I think it's helpful and fruitful. And I think that it's something that's important for us to learn as trainees. Kind of going forward, I'm excited for a future and a career of advocating for women with endo, and making sure it's something that's diagnosed as early as possible. I think for me, one of the biggest things that I learned from this panel, and even just from listening to everyone speak, I want my future patients to feel like they can advocate for themselves, and also I want them to be heard. And I think that what I've learned from this talk is, one, I want to be a better listener, but I also want to encourage my fellow colleagues to be better too. And I think that this disease and the way that it can be so debilitating is it's a struggle, and it's difficult. And I think that making sure that when we hear that maybe a patient has this diagnosis, knowing and understanding that they might have a lot of symptoms they need to go through, and that we need to hear that, and we need to make sure that we're addressing each one. I think also for me, I want to also, I said it before, but I think also address that there are biases, and I want to actively address them and bring them up. And it's something that I'm hoping to actually to even bring up to our department and see if that's something that we can address within our department and within my cohort. So I think that I just want to be a kind of a megaphone for this issue even more.